Let's see about autopsy procedure. So, what is autopsy? Autopsy is also known as post-mortem examination, necropsy, thanatopsy, and section cadaverous. Okay, so these are the other names of autopsy. What do you mean by necropsy? Necropsy, necro means dead, and opsy means study. Necropsy means necro is dead and opsy means study. Now, who are eligible to perform this autopsy? Any MBBS who has done MBBS and they are registered medical practitioners, they can do autopsy. Now, let's see what are the types of autopsy. There are usually 9 types of autopsy: medico legal autopsy, clinical or pathological autopsy, then virtual autopsy, endoscopy autopsy, needle autopsy, then we have psychological autopsy, then verbal autopsy, obscure autopsy, and negative autopsy. Out of which this medical autopsy, medico legal autopsy, this is the most common autopsy, and clinical is otherwise known as academic autopsy, virtual is otherwise known as virtopsy, and this endoscopic autopsy is known as keyhole. Okay, let's see more about each of these autopsy. First, medico legal autopsy. Medical legal autopsy, and we will see as a comparison between medico legal and this clinical or pathological or academic autopsy. So what is medico legal? Most commonly this is seen in most common in India, and here it is in the western countries. Then indication, this is for the unnatural death, which includes accidents, suicides, homicides, or suspicious death, and here it is the natural deaths. Then what is the objective of this medico legal autopsy? First we will identify what is means it is decomposed or mutilated or burnt body. Then we will see the cause of death, then manner of death. Manner of death means it is natural or unnatural death. What is unnatural death? Just we saw that accidental, suicidal, or homicidal. Then we'll see the injuries and we will document the character and the type. Then we'll see the weapon and poison which is responsible for the death. We will see if it is fetus, the live birth, that is viable or non-viable on the dead born. Then we will collect the evidences. We will collect, preserve, and forward or further investigation and the present in the court. In the clinical autopsy or pathological or academic autopsy, what we will do is we will identify the cause and pathology of the autopsy. Okay, pathology of the death. Then authorization, who can do it? Here it is the investigation officer or the police or the magistrate inquest through registration letter, and the relative consent, here it is not required, but relative consent is required here. Not required here, but relative consent is required in clinical autopsy. Examination, complete autopsy is done in the medico legal autopsy, that is all 3 cavities, that is cranial, thoracic, and abdominal, all 3 cavities are examined. Then in case of clinical, it is partial autopsy. Okay, partial autopsy means only where we suspect only that cavity we do the autopsy. Now body handover. After doing the autopsy, what we will do? We will hand over the body to the investigating officer, and here in clinical we will hand over to the relatives. So we completed this medico legal autopsy and clinical or pathological autopsy. Now let's see about the virtual autopsy or virtopsy. Second is virtual autopsy. What is virtual autopsy? We call it as virtopsy. Okay, virtopsy. So what is the procedure? Procedure of this autopsy is we will do the complete imaging of the body, like CT scan, MRI, or 3D optical measuring technique, like that. And this is the minimal invasive technique. Okay, on suspicion can be followed by intervention. So what is the objective of this autopsy? Then we will assess the status, disease, or any injury to the body. Then what is the disadvantage? Disadvantage is that only the structural lesions can be identified. The functional if the death has caused due to hypoglycemic or something, that cannot be known. Only the structural lesions can be found. Then coming to the endoscopic autopsy or the keyhole. Okay, keyhole. Now what is the procedure? Here the internal organs are seen through endoscope or laparoscope. Okay, but the advantage here, what is the advantage of this endoscope autopsy? That body remains intact, only there is a restrictive approach. Next is needle autopsy. Needle autopsy is multiple tissue samples can be taken by this biopsy needle, and then we will analyze this. So what we covered: medico-legal, clinical, then virtual, then endoscopic, then we completed this needle autopsy. Coming to the sixth one, that is psychological autopsy, and the seventh one is verbal autopsy. Let's see this together: psychological and verbal. Psychological, what is the indication of this psychological autopsy? If there is any doubt regarding the death of manner of the death, we will do psychological to confirm the suicidal death. In case of suicidal death, we do this. And what is the indication of verbal? This is a statistical thing, means for research purposes. Okay, research purposes. No, there is no accurate, not very accurate this is. Then what is the objective? Objective is to assess the state of the mind of the deceased person before death. What was the state of the mind, okay, of the person who died? Then verbal means to determine the cause of the death. Okay, cause of the death. Then procedure. How we will do this psychological autopsy? First we will interview the family, okay, friends and relatives. So by interviewing the family, friends and relatives, we do this. And in verbal autopsy, the data is collected by qualified people, and structured interview, we will do the structured interview of family and relatives, family relatives. Okay. Next, eighth one is obscure autopsy and negative autopsy. Ninth one is negative autopsy. So what is obscure autopsy? Obscure word means hidden. Okay, hidden. So what is obscure autopsy? On external as well as internal examination, no significant finding is there, means finding not significant or minimal, and here it is no finding. Here it is not significant, or we can say minimal. Okay, minimal finding. Then lab test. What about the lab test? Or history or interviews. Okay, lab test means this provides result. Okay, we get result from this, but here we do not get any result. Then opinion on cause of death. What is the opinion on the cause of death? Here it is positive, like vagal inhibition of heart, or status epilepticus, or paroxysmal fibrillation, uremia, diabetes, like this. Here it is negative, means the opinion is negative, means in 2 to 5% of all the autopsies. So this is all about the autopsy procedure. So what all we saw autopsy is also known as postmortem examination, necropsy, and thanatopsy and sexual-cadaverism. It can be performed by MBBS or any registered medical practitioner. Then we saw the types of autopsy, 9 types, that is medico-legal, then clinical or pathological and academic, then virtual, then which is virtuopsio, then endoscopic, keyhole, then needle, then psychological, then verbal autopsy, then obscure autopsy and negative autopsy.